My dentist recognized in my mouth a situation that he was not very happy with, and he wasn't very comfortable at the possibility of having to do a full mouth reconstruction, and so he suggested that maybe I move on. And I was very fortunate that not only did I already know about Carol and Swiss, but I also had her as a client. So it was a real natural exchange of saying, okay, Carol, I'm going to switch from having you as my client to now becoming one of yours. So when Carol started investigating, she said, yes, definitely, we can help you out, and we understand what you need, and we can be the facilitator of getting a full mouth rebuild and getting you back to where you want to be. Actually, I did know something about dental implants before I came to Swiss. I had the opportunity to have Carol as one of my clients, and we helped her out with her brochures and some of her literature. So when we turned around and I became one of Carol's clients, and it was really a natural situation because I understood at least a little bit about dental implants, even though it still had a mystique that still was you know, you're a little reticent to just jump right in and say, oh yeah, I want an implant. It's like, well, what is that going to do for you? You need to get educated a little bit. And Carol was very generous in her time in explaining exactly what the procedures would be like, what the results would give us, and exactly how it was going to work. And I have to say that it turned out really, really well. The reason that I came in to see Carol is that I was having trouble eating. You would go to take a bite of a sandwich and realize that you're ripping apart part of the meat that's in there, or that your teeth were not completely chewing the nice piece of steak that you had, and you realize that there was definitely a problem in terms of actually how the teeth were meshing. My situation had me where the teeth were ground down quite a bit. I didn't have anything sharp in my mouth whatsoever, and it was uncomfortable to eat certain solid foods. It was just, you know, you try to avoid certain meats and other things, and you look forward to the day when back when you were a kid and you could go, well, yeah, I took a bite of that sandwich and there was a clean bite right out of it, or you could chew that nice steak and it just felt good to chew. And I had encountered a problem where I was down to pretty much nubs on most of my teeth. A combination of the dental implants and all of the other reconstructive work that Carol was able to do here at Swiss have made a huge difference in the way that my mouth works. I now have much bigger confidence in what I'm doing in general, just because I no longer am thinking about my mouth and my teeth, where up to prior to my Swiss experience, you know, every day was maybe I better not smile too much because they'll see how the teeth have ground down, or you know, maybe we better not go have that for dinner because that may just not be a comfortable thing to be eating at this stage of things. You know, I've always enjoyed smiling a lot, and for a while there it was pretty much self-conscious about even opening your mouth. It's just back to normal again, you know. No, I don't find myself smiling more than I used to when I was a kid, but I certainly returned back to where I was from years ago, and lots of teeth damage. So it's a pleasure to be back, able to sit there and smile at somebody and know that they're not going to be going, oh my God, what's in his mouth? Carol Phillips and I have known each other for years, as I have had her as a client, and now I'm a client of hers, and we've enjoyed each other's expertise and found that there's a good mix of both of our professional experiences that are helping each other out. And without Carol Phillips and the Swiss technique, I'm not sure where I'd be today without you know, a new mouth, a new way to smile, a new sense of confidence, and especially the ability to eat fine foods. So without Carol's intervention and her caring expertise, you know, we would have a different life today than we would have 6 or 8 years ago.